Okay, so we were looking at Tinea Corporis, infection of the scalp, the head, and the hairs and the shafts within the head. And that one is infection of the hair. This one, when you talk of Tinea Corporis, this is a cutaneous dermatophyte infection that occurs in the sites other than the feet, groin, face, or hand. You know, like for example, when you talk of the Trichophyton rubrum, is the common cause of Tinea Corporis. It is the infection, dermatophyte infection. So it is still the infection of the skin, but they are saying it's an infection which is common other than the feet, groin, the face, or the hand. So let's move on and see which are these other sites they're talking about. So other common cause of Tinea Corporis, apart from T. rubrum, we have again T. tonsorans, M. canis, T. interdigitale, formerly what we call Tinea metagrophide, M. gypsum. So you could see some of these species, fungal species, they are intertwined. They can cause infection of the scalp. They can cause, other parts of the body, skin, and all that. Then, when you talk about acquisition or infection, how do we get the infection? We will do it. Uh, we get it maybe through direct skin contact with an infected individual or animals, contact with fomites. Fomites we did indicate what are they, objects. It can be from secondary spread from other sides of the dermatophyte infection, e.g., the scalp, the feet. You remember we are saying this that corporis is infection of other parts of the skin other than the feet, the face, the hand, and all that. So we are saying these other parts of the body, the corporis sites, we are talking of, it could have been an infection from infection from the scalp. Maybe you touch there and then we touch other parts of the body, you transfer the infection. Or you have foot rot, fungal infection. When you touch your feet, from there, again, you transfer it into other parts of the body. And then, like this T. tonsorians causes Tinea corporis in adults, may result from contact with a child with Tinea capitis, which is often caused by the organism. M. canis acquired by contact with what we call cat or dog which is infected. You see, so Tinea corporis can also occur in outbreaks among athletes who may have what we call skin-to-skin contact, such as wrestlers. Tinea corporis glandiatorum, which are also caused by Tinea tonsorans, is a common cause of Tinea corporis to those people out there. Now, what are the clinical symptoms of this Tinea corporis? It always begins as a pruritus or pruritic infection, you know, circular or oval, erythematous, scaling patch or plague that spread centrifugally. We want to also have what we call central clearing follows, while an inactive advancing raised border of remains. So when you look at it, they have what we call a ring-shaped infection. It can be even be at the back of on your back. It can be within your stomach, other than the feet, the face, and the hands. Because mostly you can transfer it from these common places sites that we've talked about to other parts of the body. Um, so Tinea corporis, it can be contracted from infected animals, particularly kittens and puppies, often intensely inflammatory. And this intensive T. corporis should raise concern for an underlying immune disorder. such as human immunodeficiency virus, HIV, or the diabetes. Normally, when you get this kind of infection, for those people who are immunocompetent, we expect you to heal naturally. But when this doesn't happen, then you realize that it could be because your immune system is not strong enough, and therefore it can cause this kind of infection. And the infection of Tinea corporis, this is what we mean. You can have this kind of ring or oval infection that is demarcated very well with the reddening, or abscess like, you know, uh, mm, batches that really tries to eat off your normal skin, leaving some sort of scales. So we are saying that this kind of infection is common other parts of the body other than the feet, hands, the face, and the scalp. How do you do the diagnosis? Potassium hydroxide QOH 10% preparation will be done to check for the circulated hyphae characteristic of dermatophyte infection. You always the best sample is the skin scrapings taken from the active border of the plague, the way I've shown you. This kind of plague. So the active borders are along the edges, the outer edges. That's where the fungal is very active and is killing or destroying the skin. That's where you target to collect the sample, check through QH 10%. You can also do culture on the subroid agar, this dextrose media, to check the growth and identification. Uh, you can also check for the erythromatous abnormal reddening of the skin, the way I've shown you there, due to local congestion as inflammation. You also check for the possibility of granuloma annulare, that is the benign inflammatory condition. Looks like the cells which are beginning to divide uncontrollably, which can act as a precursor of cancer, but not really cancer. That's why we are calling it benign. Um, okay, that is what we are calling erythromatous, the reddening of parts of other parts of the body. Suppose this is below the sternum and along the stomach, where the infection is causing that reddening there. It's an example. Good. Uh, Treatment. How do you do treatment? Corporis usually responds well to topical antifungal drugs such as azoles, allylamines, uh, butafine, cyclopyrox, and tolanftate drugs. So these are the drugs among this group, given out, somebody can easily respond. Research has shown that Nastadine is not very effective for dermatophyte infections, so it might not be a priority. Okay.